Have you been diagnosed with fibromyalgia? Do you think you have fibromyalgia, or do you know somebody with fibromyalgia? You probably answered yes to one of those questions. My name is Dr. David Lewis. We're going to take some time and talk about fibromyalgia. Some of the information may be new, some you may have heard, but if I can teach you one new thing that can help, I've done my job. The Mayo Clinic defines fibromyalgia as a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Research believes that fibromyalgia amplifies painful sensations by affecting the way your brain processes pain signals. Symptoms sometimes begin after physical trauma, surgery, infection, or significant psychological stress. In other cases, symptoms gradually accumulate over time with no single triggering event. It's estimated that there's between 3 and 7 million Americans that have fibromyalgia. Women are much more likely to develop fibromyalgia than are men. Many people also have tension headaches, temporomandibular joint disorders, irritable bowel syndrome, anxiety, and depression. The average age is between 20 and 50 and usually a female, but it can affect anybody. Literature states that fibromyalgia patients get better through the day, but what we see in our practice is that they get worse through the day. What do you see? Some aggravating factors are cold and humid climates, extreme changes in temperature. Sounds like our area, doesn't it? When testing in the past, doctors would check 18 specific points on a person's body to see how many of them were painful when pressed firmly. Newer guides don't require this as an exam. Instead, a diagnosis can be made if a person has widespread pain for more than 3 months with no underlying medical conditions that could cause the pain. There are no blood tests, so the diagnosis is not easy and should not be taken lightly. In many cases, a patient will go to a medical doctor for years without a correct diagnosis. In far too many cases, the doctor tells the patient her pain is all in her head. And you really start to think, I am crazy. How do you treat something if you don't know what's causing it? So here's what we do know. There should be widespread pain. The pain associated with fibromyalgia often is described as a constant dull ache that has lasted for at least 3 months. To be considered widespread, the pain must occur on both sides of the body, above and below the waist. The research behind this states that there is an abnormal endocrine autonomic nervous system or an imbalance between the two. Fibromyalgia patients experience a pain amplification, which is abnormal sensory processing in the central nervous system. That's the brain, the brainstem, and the spinal cord. What does that really mean? Well, if I stub my toe, it will really hurt. But if a fibromyalgia patient does the same, the brain turns up the signal and it feels like someone ran their foot over. For those women out there, think about having a baby. If you have a spinal block, the pain is still there, but not nearly as bad as it would be without. So that pain is turned up, not down. This is why fibromyalgia patients have severe pain, and it's real. The second area is fatigue. People with fibromyalgia often awake and tired, even though they report sleeping for long periods of time. Sleep is often disrupted by pain, and many patients with fibromyalgia have other sleep disorders such as restless leg syndrome and sleep apnea. The third is cognitive difficulties, a symptom commonly referred to as fibro fog. This means your ability to focus, pay attention, and concentrate on mental tasks has been diminished. Depression is something many fibromyalgia patients experience. This is due to a hormonal balance, either in production or uptake. Science tells us that there is a decrease in serotonin. This affects mood and disposition. If I have serotonin in my brain, I'm happy. If I don't, I'm sad. So if you lack serotonin, you will be physically depressed as well as psychologically depressed, on top of all the other symptoms you have. So if you go to a doctor and he sees this, what's he going to give you? an SSRI. Well, that's not a sports car, folks. It is a serotonin selective reuptake inhibitor. So what he'll give you is a drug that will make you happy. A happy pill. So does that correct the cause? No, it will make you happy. So that makes you a happy person with fibromyalgia. Now, this is only temporary because your body will adapt and will only work temporarily. Doctors don't know what causes fibromyalgia, but it most likely involves a variety of factors working together. These may include genetics. Because fibromyalgia tends to run in the family, there may be a certain genetic mutation that may make it more, or may make you more susceptible to developing the disorder. Infections, some illnesses appear to trigger or aggravate fibromyalgia. And physical or emotional trauma, post-traumatic stress disorder, has been linked to fibromyalgia. In our office, we find 99% of fibromyalgia patients have had some head, neck, or back trauma. So let's talk about your lifestyle and chiropractic approach. Self-care is critical in the management of fibromyalgia. Develop a plan to avoid or limit overexertion and emotional stress. That may mean learning to say no. But don't change your routine completely and don't drop out of society. People who quit work or drop all activities do worse than those who remain active. Stress management, deep breathing exercise, and meditation are all helpful. Get enough sleep because fatigue is one of the main characteristics of fibromyalgia. Again, relaxation techniques and aromatherapy can be very helpful with sleep and restless leg syndrome, which can be another factor of decreased sleep. Exercise is a double-edged sword. Start slow and gradual. Increase activity levels slowly with your duration and frequency. Biking, swimming, water aerobics are all helpful. Maintain a healthy lifestyle means eating healthy foods, limiting your caffeine and processed foods. Do something that you find enjoyable and fulfilling every day. In our office, laser therapy is a tool we use because muscle damage and chronic pain are characteristic traits of fibromyalgia. Two of the major benefits of laser therapy is stimulation of tissue healing and decreased sensations of pain. Finally, chiropractic care should be a cornerstone in your lifestyle change. Remember, 99% of fibromyalgia patients have had some sort of head, neck, or spinal trauma, which have caused spinal subluxations. Vertebral subluxations are focal areas of spinal restrictions. When present, these lesions can not only irritate the nerves that exit the spine, but the irritation caused by subluxations will also feed back into the brain. Information from the joints of the spine is passed on to an important structure in the brain called the cerebellum. This part of the brain has been known traditionally to be important for body awareness, balance, and coordination. However, more recent studies have shown the cerebellum to be intimately involved with maintaining proper cognitive function and playing a significant role in emotional stability. Therefore, irritation of the joints of the spine caused by vertebral subluxations may be linked to any of the symptoms associated with fibromyalgia. So, if I can be of any help, please give our office a call at 603-428-3338, and thank you for taking the time to watch the video.